Kia ora, Don Banks, tuko anoa, and today we're talking about the requirements for the summative reflection in the altered cognitive states paper. So just a short tutorial to go through the requirements of this assessment. There are 4 elements to this tutorial. Firstly, you just want to clarify the task, make sure we've got the correct focus on what's required. To talk about some of the suitable presentations and how they align, identifying aspects of care that can be challenging, and finally we'll explore the model for which we expect the reflection to be written in. So the overall task is to write a reflection, and the purpose of this reflection is to demonstrate the ability to reflect on your practice, and that this will lead to enhanced care for patients that have altered cognition. Or in other words, we're looking to look more inwardly at a case, to look at the practitioner's performance in the case, as opposed to looking at, say, a drug or a piece of equipment that would enhance care. So we're going to be looking at the very human processes of delivering paramedicine. So this is way more likely to be related to your knowledge around assessment methodology and or communication skills in situations that are very specific to where altered cognitive states exist. So the first task is to choose an interaction with a patient with a non-acute altered cognitive state. So this might be someone who has an organic change that has led to a dementia, some form of TBI perhaps that's left permanent damage, a stroke that's left ischemic damage, and that's had an impact on the person's cognition. Some other examples that you might have the opportunity to look at might include things such as alcohol-induced dementia. It may be from dealing with people that have learning disabilities, they have neurodiversities such as an attention deficit disorder, or they're on the autism disorder spectrum. So having selected a case, the second thing you need to do is reflect on one aspect of this case. So the key is to focus on one aspect of the case. Some examples might include a communication barrier, dealing with behavioural issues, understanding the nature of the diminished competency that the patient has. It may be around the interactions with whānau or carers at the scene, or discomfort that arises from a bias or a worldview that's come into play. So the role of any clinical reflection is to recognise the background factors that influence performance and decision making, or in short, what sits behind the way you felt and acted on the case. So we can talk about some examples of things that may cause this when you're dealing with non-acute altered cognitive states. And these might be communication issues that relate to maybe hearing or to speech or a person's ability to understand what's going on. And it may influence things like gaining history or being able to do a physical assessment. Maybe around the understanding of the condition itself and what the expected behaviours and how to establish a baseline in those conditions. It may be related to gaining informed consent and what was required to gain an assessment of somebody's capacity. It may be issues around having family or whānau or other advocates there for the person, and there may be some division or some friction around the aims of different people and the people that are providing care, or it may just come down to an unconscious personal bias that influence the way you approach the case. And the next part of the task is to identify a way forward. So this is around identifying a tool or approach from literature and outline how you're going to use this to develop your practice on future occasions. So as an academic exercise, you will need to validate this tool. And you can search for an assessment or a communication tool specific to the situation. And the last part of the task is the utilisation of the Johns model to run the reflection. And to do this, the simplest way is just to use the headings that are suggested in the Johns model, which is firstly to describe the experience, then move on to the reflective elements before looking at the influencing factors, And then could I have dealt with it better is basically a heading that opens up the capacity to talk about what tool or influences that you can use on future cases to achieve a more credible outcome. So the next part of the tutorial is just going to be a brief overview of the Johns model itself. So John's model of reflection is based around the 5 questions that were posed on the last slide. These enable you to break down your experiences and reflect on the process and the outcomes. And as we said, the aim in this is to improve practice. We want the description to be very specific to the case and only involve the significant factors, because we're asking you to look at one aspect of the case. So the description needs to be focused on that one aspect. So do consider writing this later, or at the very least editing it once you've written the rest of the work, because in terms of preserving a word count, there's only 1,000 words to do this. You want this to be as brief and as focused as possible. So in the model itself, you're asked to look inwards to consider your own thoughts and feelings and how they've influenced things. And secondly, to look outwards, and this is to consider the situation at hand, which will include what actions that you've taken, whether they met ethical standards, and whether they're going to be external factors that influence the way that the thinking evolved and the case evolved. So in terms of reflections, here's some questions that can help getting things underway. But one of the first things to consider is how you felt about the experience at the time it happened. And this question can provide great insights. It's quite easy to link your feelings to what was happening in the background. And I'll suggest that frustration is quite a common one that will happen. And frustration is normally linked to not having expectations met. So you could go into a scene expecting a particular type of response, and when you don't get that response, it can engender frustration. You can look and reflect on why you reacted the way you did. Sometimes it pays to look at parallels. Has something like this happened in the past? Are there commonalities that I can look at as to why I reacted the way I did? And particularly when it comes to what our expectations of other people are in terms of, say, a worldview. And I'll suggest that when we're dealing with people who are influenced by alcohol, for instance, our reactions to that are quite often associated to a bias and a worldview. Another thing that we can look at in terms of reflection is to re-examine what we thought our goal was for our behaviour at the case. And that can open up 2 further areas to reflect on. The first is, was it actually the correct goal for the situation? And secondly, if it was the correct goal, was the way I went about achieving it suitable for that specific situation? Another element of reflection which is really important is being able to identify the repercussions, particularly for other people, such as how has this made other people feel? And the last element that's offered here is to just have a look at the ethical considerations. And when I'm talking about ethics, we can consider what the Paramedic Council has offered, or we can look at those general bioethical principles such as autonomy, for instance, and whether that's been maintained or not. So in terms of writing up the area of reflection, what we're looking for is that inward gaze that identifies what from within you has influenced the case. And from here we can move on and discuss what the external influencing factors were. So we've talked about the internal influences, and we can look at the parallels on what I was trying to achieve and how did I interpret the situation and why did I do it this way. And then secondly, we can look at outside influences. So this might be what other people are doing at the scene, or maybe it was precursors to us arriving at scenes, such as information we were given or expectations that were put on us. We can ask whether these were reasonable under the condition or how they have influenced your actions at the scene. And then we get to the fun part of the reflection, which is, could I have dealt with this better? So this is the avenue to re-examine and offer information as to how things might be improved or reinforced in some way for the future. And we can revisit whether the goal for the situation was correct and whether or not the actions taken to achieve those goals were the best way forward in that particular type of situation. And then we get to the meat and bones of this, is what knowledge or choice could have improved the situation. John suggests there might be 4 areas that you could sort of look at around this, and the first is the sort of empirical, the scientific route for looking for improvement. So empiric data is the facts or what has been validated via research and studies. So this is different from a theory or a line of logic or some form of intuition, because it has been observed in action and commented in research. So a great example would be something such as a communication tool, such as ISBAR. So if we were looking at situations that involved communication with another person, it may well be, not necessarily so, but it may well be that ISBAR would have been a useful tool to have used. And of course there are studies that show when clinicians use this in a very specific situation that it's going to achieve better results in terms of communication. You might be looking for a cognitive forcing strategy or a specific tool that research has shown to be effective in the situation. There may be ethical imperatives. So these are the professional and ethical responsibilities that you can show, and whether these could be met in a better way perhaps. And I said before, we can go to the Paramedic Council for a list of these things, or we can use bioethical principles, which would include the respect for autonomy. Now the same can be true for legal requirements in situations for this, because we know that there are legal imperatives for the way that paramedics practice, and these are set out by various acts of law and the Health and Disability Commissioner. So that's another avenue to explore as to what could be improved on a case, and then how to go about it. Self-awareness is another avenue. Now this is a slightly more subjective aspect when you're writing a reflection, and it's around how you perceive the situation and whether there can be a way to improve or reinforce in terms of providing good outcomes for patients from a particular type of case. So from this you can discuss new thoughts on self-management and your self-awareness, and your management of your professional relationships and interactions in the context of the event that you have reflected on. And the last area that John's model would suggest to look at is aesthetics, and I find this a little bit confusing because the term's normally associated with all things beautiful and all things artful, but in this case I think the term might be applied to the sort of kaupapa of paramedic work. It might extend to considering the heurisms that drive our mindsets or help us navigate more complex cases. An example of such heurisms is the one that says a patient can have as many diseases as they damn well please. It's known as Hickham's dictum, and it's a medical maxim that advises clinicians to avoid premature closure by considering multiple coexisting pathologies that may have caused a patient's symptoms, rather than a single unifying diagnosis that explains everything away. And this is so true where there are mental health issues or people who are more elderly present, and everything just gets written off to a single unifying problem such as dementia. The premature closure prevents a search for the underlying issue to the symptoms that are occurring today. The last part that John suggests to do to complete your reflection is to take this knowledge forward. So what we're asking for here is an explanation of how you're going to incorporate this knowledge into your future practice. You might look at what's going to be a suitable trigger for knowing that you're going to use this knowledge. And you can describe what actions or tool that you're going to use. You can describe who it's going to be used with. So is this just between you and a client, for instance? Is this going to be you and other health practitioners, or is it going to be with other carers or whānau members. But essentially it's just an explanation of how all the knowledge from the can I do it better might be incorporated into the next similar case that you attend. And finally, you might write up a conclusion about how you feel overall about this experience with this new knowledge in mind. I'll just finish this up with a couple of points on formatting. So we're going to use the APA guidelines for all your formatting, so that will include things like where the margins on your page sit, double spacing, and how you would present your reference material. The word count for this is 1,000 words, plus or minus 10%. It's a bit of a squeeze, so the need for clarity and conciseness should be paramount. So we're going to use the new rubric for grading this. The rubric's available in the course outline. Really strongly recommend that you have a look at this because it's got some very clear points about how each of the learning objectives for this paper that are specific to this assessment can be met in terms of getting A, B or C results. And you'll submit it via the Dropbox in Moodle, which is the Turn It In link for that particular assessment. I hope this has been useful. Feel free to get hold of us if you've got any questions. Myself or Matt are only too happy to help you in terms of developing this work. In the meantime, ka kite.